MMT, shoulder internal rotation, subscapularis. Assist the patient to the prone position with the head turned to the test side. The shoulder should be abducted to 90 degrees with the humerus fully supported on the table. Allow the forearm to hang vertically over the edge of the table. Place a folded towel under the arm at the edge of the table to keep the elbow and shoulder level to each other. Stand at the side of the shoulder being tested. Passively internally rotate the patient's shoulder. Stabilize the arm by placing your hand at the elbow joint to prevent the humerus from moving. You are not assessing the infield. You are determining how much range the patient is able to move the shoulder in this direction so that you can appropriately assign a muscle grade. In patient-appropriate language, ask the patient to internally rotate the shoulder. Stabilize the patient at the elbow joint to prevent the humerus from moving. Please note that it is not necessary to have the patient perform the active motion twice if no substitutions are observed on the first attempt. You may apply the resistance at that point. Common substitutions include using the pectoralis major, which will row the shoulder forward, and using the latissimus dorsi or teres major, which will bring the humerus toward the side of the body. After correcting any substitutions, ask the patient to perform the motion as previously. Stabilize the patient at the elbow. Place your other hand on the anterior surface of the forearm and apply the resistance in a downward and forward direction. The resistance is applied in a direction toward external rotation. Apply the force for a 5-second count. Grade 5, normal. The patient completes full range of motion in shoulder internal rotation and holds against strong resistance. Grade 4, good. The patient completes full range of motion in shoulder internal rotation but breaks against strong resistance. Grade 3, fair. The patient completes full range of motion in shoulder internal rotation but does not tolerate any resistance. If these conditions are not met, the patient must be repositioned to a gravity-eliminated position. Keep the patient positioned in prone. Allow the patient's arm to hang down loosely from the shoulder in neutral rotation with the palm facing the table. You must again assess the available motion by rolling the arm into internal rotation. Place both hands above the elbow joint to assess internal rotation. The gravity-eliminated therapist position is to kneel or sit on a low stool at the test side of the patient. Instruct the patient to internally rotate the shoulder by turning the palm inward. You need to observe for the common substitution of forearm pronation. Watch for the olecranon to move and not the hand to turn inward. Grade 2, poor. The patient completes full range of motion of shoulder internal rotation. For grade 1, you must palpate the tendon of the subscapularis. Place your fingers deep in the central area of the axilla. You may have to stabilize the test arm at the shoulder. Grade 1, trace. Palpable contractile activity with no motion. Grade 0, no palpable contraction.